Hello and welcome to Talk Room. I'm Bansy Kallapa, and with me is a special guest, Dr. Roshan Jain, who teaches psychiatry as a professor at a medical college, and also you practice psychiatry in India and in UK.
Yes.
Well, first of all, Doctor, I'm going to be talking to you about suicides, the problem of suicides across the nation, and specifically as regards suicides in Indian Institute of Science, where we saw about 6 cases of suicides in a nearly 2 year period. So the authorities have ordered for the ceiling access, to the roof access to be closed. They've also asked for ceiling fans to be removed, and they've asked for wall mounted fans. Now, all these are among the remedial measures. Is this sufficient to deal with a problem so big?
Thank you for inviting me to talk on this very important topic. Firstly, I must say that death by suicide is an unspeakable tragedy for family, for friends, and also for institutions. And unsurprisingly, when such tragedies are happening in a recurrent fashion, then there is a tendency to take knee-jerk decisions about changes that need to be made, often structural changes rather than functional changes. In this case, removing ceiling fans, restricting access to rooftop and so on, to prevent any further suicides. But I think these are not fully thought through and perhaps even naive way of looking at this very, very tragic way of ending life. So more needs to be done, and more needs to be thought through in terms of how we can help student mental health in a more effective fashion.
Also, suicide as an issue itself challenges medical professionals across the world and also in our country. And Bengaluru has the distinction of being among the top suicide prone cities in the nation.
Yeah. Suicide is very common worldwide. About 1 million die every year, one every 40 seconds. India is one of the top countries where suicides are happening. Karnataka, Maharashtra, Madhya Pradesh, these are the top states where suicides are happening. And in particular, the student suicides are quite high. So 15 to 29, we are seeing a large number of suicides. Suicide being the second leading cause of death in student population. So their mental health needs to be a priority for every institution across India and across the world. In India, there are 12,000 suicides every this year alone, so in 2020, and there has been a significant increase in suicides since 1995. In terms of percentage, there used to be 5% suicide of total suicides. Now we are 8%. So quite high and quite serious matter that needs to be dealt with in utmost depth.
Also, if we look at it as an institution, what needs to be done to deal with this issue in a very effective manner?
Yeah. I don't think many institutions are taking a very rounded approach into how to deal with student suicides, but importantly, how to deal with student mental health. I think there needs to be a comprehensive mental health program or mental health awareness program in all institutions, starting from students' awareness, where we can educate students about how to identify stress, anxiety, depression, what to do when they do identify it, what are the lifestyle changes that they need to make, and when to seek help. So timely interventions is very, very important. Equally, educators, staff need to be sensitized about students' mental health, how to identify signs of stress and anxiety, how to identify signs of student becoming pessimistic, hopeless, helpless, and suicidal, and what to do in those instances, how to signpost these students, but before signposting, how to talk to them about suicides. Now, there's a lot of evidence to suggest that talking about suicide doesn't increase suicidality. In fact, it quite reduces it. And equally, we need to have qualified counselors, psychologists, and psychiatrists to be on campus, to be able to help those who have been identified as having stress and anxiety and depression, but also being open to students who can contact them 24/7 for a confidential and discreet services. But these are just clinical services I'm talking about. We need to have a consistent campaign of reducing stigma of mental health across the campuses. We need to write articles. We need to publish material on mental health. We need to publish stories of people who have had suffered from mental health problems and recovered. Those are the things which will motivate people to come forward with mental health issues and seek help. Academic institutions have reported, in US for example, that 16 to 20% of people have reported consistent suicidal ideation while in their academic years. and a large number go on to harm themselves, and their peers have no idea as to what to do when they identify their friends as being suicidal or wanting to kill themselves. So we need to sensitize a large group of people, educate a large group of people, make people aware of these pertinent issues that is affecting education institutions and students. And students are our future. We need to safeguard their health, we need to safeguard their lives, and we need to do much more than making just structural changes or removing ceiling fans. I think institutions need to sit down and take this matter very seriously, so that a comprehensive plan can be put forward.
Also, there is this abuse of party drugs, abuse of antidepressants. Someone just feels sad, he pops in an antidepressant. Someone feels anxious, they pop in an Anzit or some anti-anxiety pill. Someone has an exam, they just pop in some memory tablets. This issue of abuse of these easily available medicines, does it contribute in any way to suicides?
From medical point of view, we know that many students are taking drugs, over-the-counter drugs and pills and so on, as you mentioned, as a self-medication. So if you can't handle stress, you can't sleep, you're feeling depressed and gloomy and so on, people are self-medicating themselves by buying drug over the counter or off the streets. And this is a shortcut remedy to a very serious, deep-rooted problem. And I think that needs to be, we need to educate people about avoiding them and to be taking pills only when they are prescribed under professional supervision. And psychiatrists are qualified to do that. So they need to be under the guidance and only take medicines where necessary. So in many cases, people are taking these pills when they are not required and often find themselves abusing them and becoming dependent on them. And we know that there's a deep correlation between drug abuse of prescribed and unprescribed and street drugs and suicide or completed suicide. So this needs to be dealt with in a proper manner. We know that drug abuse can be quite common, and alcohol abuse can be quite common across educational institutions, and there needs to be a separate program on the drug and alcohol abuse for students. Migrant students in hostels and students staying away from the family do find themselves getting driven in the wrong direction many a times. All they need to be done is to be guided in the right direction, of being guided to manage the stress and anxiety in a more effective manner. In doing so, we can save many lives.
Okay, so thank you, doctor. So what we have is Dr. Roshan Jain telling us that suicide really is actually a problem which can be classified, which can be divided into tiny areas and dealt with in a very, very specific manner, but very effectively across all areas. So it can be migrant issues, it can be a whole host of issues, but each one of these can be dealt with effectively. Now what we have is Dr. Jain telling us that these remedial measures need to be in spirit and not only in letter. So is Indian Institute of Science doing it? Are the medical professionals, authorities doing it across India? These are questions before us. With camera person Nagraj Gadekal, this is Bansy for the Talk Room.